Well, good afternoon and welcome back. Hope you all had a very enjoyable weekend. I thought it would be appropriate to bring us up to date on where we are in our region's response to this pandemic. When we last left you, our county was placed by the state on a watch list along with 31 other counties across the state. We got there because of our growing numbers of cases and community outbreaks and other metrics that triggered our placement on that list. As a result of being on that list, we now have new restrictions which were imposed, including bans on indoor dining and other outdoor activities that could further fuel the spread of the coronavirus. Now that we find ourselves on that list, many of you are asking the same question I think everybody is asking us: how do we get off of it? There is no silver bullet or magic trick here. The best way to get off that list is to take the simple steps that we've been talking about for really these last couple of months. Getting everyone to cover their face, maintaining space from other people, washing their hands, and avoiding large gatherings with people outside of your household. I know that there is a lot of frustration out there and a kind of COVID-19 fatigue among a small minority of people. But refusing to take these steps is just going to prolong the restriction and keep us, unfortunately, on that list for a longer period of time. You want to get back to normalcy? So do I. But that's not going to happen until we take the steps to gain control of this pandemic, and we must all do our part, and frankly, all of us are a part of this effort to get on that off of that list. Well, with that, I'm pleased to reintroduce Supervisor Fletcher, who's back in the flesh today. I'd like to welcome Nathan back, and he's going to bring us up to date on the numbers, and he'll be followed by Dr. Wooten.
Thank you, Chairman Cox. It's nice to be back in person. As Chairman Cox just mentioned, our numbers in San Diego are trending in the wrong direction. But the good news is we do have it within our control and our ability in order to slow the spread and in order to get things back in control. In San Diego, initially, we did an incredible job out of the gate with our response to COVID-19. And then as we reopened, things slipped. And we began to see significant increases. Our numbers around the case numbers and our numbers around community outbreaks went in the wrong direction and are continuing to go in the wrong direction. And we have to get these numbers under control. But they're not just numbers. They're community transmission of COVID-19. They are outbreaks. But we have it within our power and within our ability to slow the spread, to rein these numbers in, to get back off of the state watch list, state monitoring list, and to begin to progress in the new normal with as much open as possible while we wait for a vaccine or a therapeutic treatment. But if we want to have an opportunity to safely reopen schools, if we want to get some of these businesses back open, then it's incumbent upon each and every one of us to play an active role and to be a leader. Every single San Diegan has within their power the ability to do their part to help us. And those are the things that we continue to reiterate and have been for months by taking that individual responsibility to avoid large indoor gatherings, to utilize a face covering, to ensure that we're doing things like hand washing. Then if we do that, then as we did once before, we can once again rein in the spread, rein in the number of cases and outbreaks, and continue forward as best we can. You know, every day we talk about the triggers and the numbers and the metrics, and in San Diego County we have 13 triggers. They are a mix of federal, state, and our own scientific guidelines on things that provide us insight into how we're doing on a daily basis. And we've talked a lot about one of the challenging things of coronavirus is the lag between when something happens and when it shows up in our metrics, and the lag between the need to take action before it might be completely evident that you have to take that action. But there's also a lag that even after we maybe turn the dial a little bit more in the restrictive way, there could be some time before we see the impacts as a result of that. And that requires a tremendous vigilance on our part. It also requires a tremendous patience. and an understanding that the situation we're in is very challenging. It's challenging for parents who are trying to educate their kids. It's challenging for small businesses that are trying to navigate how they survive. It's challenging for seniors who may be isolated. But it is a situation that as a people we can confront and overcome, but it will be challenging, and we still have a ways to go. We're trying to learn and figure out how we adapt to the new normal where we can control the spread of this, slow the spread of this, in a way that allows us to get as much open as possible, again, while we wait for that vaccine or therapeutic treatment. The triggers are important in terms of identifying challenges and problems beforehand, and they're broadly broken into three categories. The epidemiological triggers, which revolve around surveillance in terms of what we're seeing in San Diego on real time. The healthcare metrics, which revolve around our hospital and healthcare sitting capacity. And then the public health triggers, which involve our ability to respond and track and deal with what we're doing. And each of these are ones we monitor in real time. Obviously, in the last month, we've seen challenges around our case rates, which is what put us on the state monitoring list. We've seen challenges around community outbreaks, which is a San Diego unique metric that we track around community outbreaks. And we've seen challenges in recent days around case investigations, or 3 that we've had problems with out of the 13. But when you file for attestation from the state of California, which we did, we are bound by those state monitors and state triggers. And so we need to get our case rates down, we need to get down, and we need to stay down for a significant period of time. We've been on the state's monitoring list since July 6th because we have not had 3 consecutive days exceeding the 100 cases per 100,000 residents. Today we're going to report we're at 145, surpassing the state totals, but also putting us back where we were in early July. And so our hope is, as we come together as a community with a greater awareness and greater vigilance, as we've reimposed some restrictions on those locations and entities causing the most outbreaks, that we can begin to rein this in. But it's not just the actions that we take in public health orders, it's the decision that each and every one of us make. If we want to come together and ensure as much of our economy is open as possible, if we want to come together and ensure we have at least an option at safe reopening of schools, if we want to continue in a forward progress, we all have to recommit ourselves to slowing the spread, lowering the transmission, and navigating through the challenging situations that we're in. Because of the significant increase in cases, which hit very rapidly and has continued to increase over the past few weeks, we have had challenges around case investigations, and I want to briefly address that and what we're doing to try and increase the percentage of case investigations that are conducted in the appropriate time frame. The T3 strategy, which we talk about a lot as one of the cornerstones of our ability to move forward, is testing, tracing, and treatment. The testing we've talked about in great depth, including last week, things we've done to address challenges in the testing system and keep our numbers high, but also increase the speed at which we get results. In the tracing category, because of the significant increase in cases of the past few weeks, we have experienced challenges. We have a team of 522 in our tracing division right now, and that is split between contact tracers and case investigators. And it is important to understand the difference between the two. Out of our current number of employees focused on this, we have 223 case investigators. A case investigator is assigned anytime there's a positive case. These are folks who have tested positive for COVID, and they will first be contacted by a case investigator to really get all of the information surrounding where they went, their exposure, potential ties to outbreaks, along with who their close contacts are. But that is about a 2-hour process for the case investigator to talk to the positive contact. Once that case investigation process has been underway and successfully conducted, then the contact tracers are the individuals, and that's about 237 of our folks are contact tracers. The contact tracers go out and reach each of the close contacts to let those individuals know that they've been in close contact with a positive and the appropriate steps they should take surrounding quarantining. Our contact tracers are doing very well, getting in contact with 90% of all of the close contacts. That's one of the triggers, and that's an area where we continue to do well. Where we are having trouble is with case investigations. Our case investigation system has been overwhelmed by the massive increase and very rapid increase in positive cases. And the percentage of cases being investigated is below our established metric of where we want it to be, and we are taking corrective action. As I mentioned earlier, we currently have 223 case investigators, and the simple reality is we need a lot more. In order to bring on more, to get that percentage completed raised, we are redeploying county surge staff who are appropriate from other roles to augment our case investigation team. Additionally, we have people in the pipeline to be hired, and by Friday, there will be 97 additional case investigators that starting Friday will be handling cases. So a significant increase this week. In addition to that, we're hiring 212 more case investigators. Right now, we have received more than 2,300 applications. The application period closes today, and we will be going through that and hiring, again, 212 more. So in this week alone, we look to be bringing on the 97 new case investigators, along with county staff we can repurpose and quickly train, and the 212 that are in the pipeline, which will more than double our case investigator capacity and staffing, which we believe will allow us to get those case investigations performed much more quickly and allow us to begin the contact tracing process much more quickly and hopefully allow us to continue to slow the spread. And so as we've gone through this, we time and again have encountered challenges. We work as rapidly as we can to try and confront that challenge, address it, and move forward, and that's certainly been the case with testing and now with our tracing efforts. And so we continue every day to strive to do everything possible to do what we can to confront the challenges before us. With that, let's jump into today's numbers. Starting with our T3 chart, you will see again our testing, despite the challenges we talked about last week, remains very strong. 7,884 tests reported today. Our 7-day average is at over 8,900, again, well in excess of our initial goal. We also today surpassed the 500,000 test reported threshold for our region, and we continue to do well as an urban county as it relates to this. In tracing, I spent a fair amount of time previously talking about this, 522. We expect that number to increase significantly this week, well above 600. But again, that 522 is a mix of case investigators and contact tracers, and we're now over 27,000 investigations performed. And then you can see our county individuals in public health isolation rooms. Moving next to our COVID percentage positive. Today we're reporting 453 new positive cases out of the 7,884. This is for a 6% of our tests are coming back positive. Again, you can see on the purple line there the significant increase that we saw. We appear to have stabilized a bit in percentage of positive. We would like to see that number begin to trend down and get back closer to where it was when we were in compliance with state monitoring data. COVID hospitalizations, not a significant change yesterday to today. COVID-related ICUs are exactly the same. Non-COVID hospitalizations are down just a few, again, holding relatively stable. Total hospitalizations, you'll see on the next chart, there in the bottom, 482, virtually unchanged. Increase a little bit from yesterday of total hospitalizations. Again, we're creeping ever closer to that 80% bed capacity of our healthcare system that we are trying to avoid. And so we want to continue to see these numbers plateau and stabilize. There is also a concern that hospitalizations, COVID-related, are a little bit of a significant delay from outbreaks and from cases, and so we continue to monitor these numbers with great interest. And then our next one is our ICU capacity. Again, COVID-related ICUs on the next chart is basically identical to where it was yesterday. Non-COVID came down a little bit, so we're sitting right there at 67% in our ICU capacity system. That concludes my report. I'll now turn it over to Dr. Wilma Wooten for a public health officer's update.
Thank you, Supervisor Fletcher, and welcome everyone to today's briefing. As is our practice, our global, national, and state statistics is based on the data that we retrieved from the Johns Hopkins dashboard, and it was obtained today around noon. For our County of San Diego statistics, the total number of cases today is 24,135 cases, which is 453 more cases than yesterday, which is actually a decrease from the prior day's report of 560 cases. The total includes 478 deaths with no new deaths reported yesterday. The age range for on the next slide, for all of the cases is from 3 months to 102 years of age. 59% of our cases are between the ages of 20 to 49 years of age, and this has increased by another percentage point from last report. 51% of our cases are female, 49% are male, and 9%, or 2,215, have been hospitalized, and this includes 575 cases that are in the ICU. This number is 2% of the total number of cases and 26% of the total number of those hospitalized. So again, there are 478 total deaths, which represents 2% of the total number of cases. 210 or 44% of those who have died are female, and 56 or 268 are male. 95% of the total number of cases who have died had underlying medical conditions. And as always, our sincerest sympathies and condolences go out to the families that have lost loved ones due to COVID-19. Now, in the next series of slides, we will review some additional visualizations of COVID-19 demographics related to our EPI curve, case hospitalization, ICUs, and deaths. And this is our EPI curve. As you can see, from mid-April through May, actually most of May and in the early part of June, we were flattening the curve. And then after June 12th, we started to see cases increase. And actually, on Friday, we had the highest number of new cases reported to date. So we are seeing these numbers increase, but we hope that the actions that have been recently taken over the past 2 weeks, or almost 3 weeks now, will help to flatten again the curve and bring our number of cases down as these actions help to decrease community-wide spread. And the next slide, this just basically shows the actions that were taken in mid-June as we were elevating the dimmer, if you will, sliding it up and opening more businesses, and we began to see numbers increase, which ultimately resulted in actions taken by the state to lower that dimmer, to decrease opening of some of the businesses that had already been opened. In the next slide, in the next few slides, we're going to talk about cases, hospitalizations, ICUs, and deaths. So here you can see that in the this week associated from June 11th through about June 17th, for new cases, we had 3,743 total number of cases. So this will, on Wednesday, we will slide that week's total number of cases for that week over to the left, and you will see that this is the highest week of new cases reported to date. In the next slide, this is hospitalizations, and for the week that is on the right, that is a total of 163 hospitalizations. So as you can see from June 12th on, the hospitalizations were higher than the prior week, and in this next week that's on the right side of the slide, that number will be higher than any of the other weeks. In the next slide, we just wanted to show again hospitalizations. There's some encouragement. In the last 3 days, hospitalizations appear to be coming down, but we need that to decrease much more than in the prior week or so. So the actions that we have taken to date, we anticipate it will help to drive this metric down, as well as the overall number of cases is anticipated to decrease. In the next slide, this is ICUs, which are a subset of hospitalizations. And as you can see from July 13th, we had increase with a slight decrease in the week for July 4th. And we also see for the next week, those numbers will be elevated as well, above 25. Going to the next slide. So we have had a total number of 478 deaths, and from June 3rd to the following weeks, we've had an increase in a weekly basis of 4 deaths. But we see that this particular week also is going to be elevated above 35. So we will continue to watch that, this particular statistics as well. Now let's move to our triggers. The next slide shows the triggers, as Supervisor Fletcher referred to earlier. There are 3 triggers here that have been abnormal, at least for the past 2 weeks. Case rates is the first one. And actually, in the next slide, we will show case rates, which is the metric that has placed us on the state's monitoring list. We have been lobbying back and forth between a high of in the 140s and the 150s. If you can go to the next slide. So for the last 6 days, that's what we see here from on the 15th, we were in the 140s, then on the 16th in the 150s, and we've been going back and forth for the last 6 days. What we want to see is that the 145.3 continues to decline. But that will only decline if the total number of new cases that we see each day also declines. In the next slide, which is trigger number 2. These are our outbreaks, and this trigger is 7 or more outbreaks in the last 7 days. So the shaded area is the last 7 days, and we have a total of 16 outbreaks in the last 7 days. If you look at the right side, if actually, let's look on the left side at the highest bar there, which shows 24 outbreaks for the week of July 1st through 7th. For the next week, July 8th through the 14th, there are 14 outbreaks. And then the next period from July 15th through the 19th, there are 5. So there appears to be a decreasing there, but we will continue to monitor over the next 2 days to see what this last week looks like. Now going to the next slide, which is related to our community setting outbreaks. This is the list for the last 7 days, which is the second trigger. And what this shows, actually, I'll give you a summary of all of the cases. Of the 16, and you can go to the next slide, of the 16 various settings, 6 or 38% are in restaurants and bars, 4 or 25% are in personal care settings like salons or gyms or barber shops, and then the remaining 6, which represents 37%, are in various different type of settings, from one in a preschool, a manufacturing facility, government setting, and a residence or a laboratory, or a place of worship. If we go now to the next slide, what I wanted to show here is just an overview of all of the 107 outbreaks that have occurred since the pandemic has begun by month. And as you will see, in March, the 3 total there represented 3%, 16 for April, 15% of the total. May, we had 8 community outbreaks representing 7%. And then in June, again, aligning with the increase in opening up, we had 33 outbreaks, which is 31% of the total number. And then for the month of July, we had 47 outbreaks, which is 44% of all of the outbreaks. Next slide, please. So this slide is the last trigger number 11. And Supervisor Fletcher also talked about this in his update. But what this shows is that as we began to increase the total number of daily cases, new cases, our staff just couldn't keep up. But the mitigation for that is, as Supervisor has reported. And the strategies that we are employing to mitigate this include deploying 15 county surge staff and allowing overtime, onboarding 27 new case investigators from temporary staff contractors, promoting 20 more, or promoting 20 contact tracing team leaders, and then hiring 26 staff from pipeline of new case investigators who have submitted applications and who will be trained this week and start on Friday. And we are onboarding 3 certified temp nurses and an additional 9 staff that have already gone through the hiring process. So in total, as stated before, we have 97 case investigators that will start and take their first case on this Friday. So, as everyone should be aware, the pandemic is not over, as is evidenced by the data that we've shared with you today. The virus is still widespread in our community. With the actions taken over the past 2 weeks, and with your help, we expect that these cases will decrease. We can get through the pandemic, but it really requires that we all do our part and work together. And in this last slide, it shows that the strategies that need to be taken, washing your hands, sanitation in the locations where people are working or spending time if they are not at home, staying 6 feet apart, wearing a face covering, avoiding crowds, and stay at home if you're sick. We implore to you to not wait for someone you care about to lose their fight against COVID-19 before you take action. So the time is now to take action, and we are depending on everyone that is listening to my words. So now, please welcome back to the podium Chairman Greg Cox. Thank you.
Okay, we'll go directly to the questions.
Brandon Lewis with CBS 8, go ahead.
Announced new guidelines for hair salons and barber shops and nail salons to reopen outside, and the city of San Diego recently adjusted its rules to allow this, but both require the public health officer's approval. So I have a two-part question. First, does Dr. Wooten plan to okay these outdoor services? And two, perhaps someone from the county, maybe a supervisor, could address if there will be a restriction on the types of services that these businesses can provide because of the potential environmental impact of the chemicals that we use. The governor made reference to this and said it's up to local governments to decide.
Okay. I believe Dr. Wooten was going to speak first, and perhaps Supervisor Fletcher.
I understand the question, do we approve of any businesses operating under the requirements that the state has clarified, and absolutely. As we have stated numerous times before, we are really trying to walk the balance between allowing businesses to operate as well as keeping the public safe. So in these modified operations, we certainly do support those. Thank you.
Yeah, thank you, Andrew. I think the changes that you're seeing, both what the state did, things the city's done, things the county's done to facilitate outdoor operations, really are based in the evidence that we've seen in terms of the safer environment for outdoor type settings. And in order to facilitate that, there's a lot of things that need to be done. around the regulatory proceedings, around fees and permits and those types of things. But I think what you're seeing with personal care services, whether they be barbershops or salons, what we've been doing around potential road closures and facilitating opening of outdoor gyms and outdoor restaurants really is a recognition that the outdoor settings are much safer and provide a better opportunity to allow businesses to continue to operate and the consumers to be in a safer environment. And so I think we're going to have to continue to do more of that as we look for that. And I think in San Diego, we have a natural advantage that other areas across the United States don't have because of our weather. And so I think the changes that you're seeing made are recognition of the realities and again, us finding creative ways to adapt to keep as much of our economy open as we can in a way that's safe. And so we support all of the steps that have been taken, and we'll be there to facilitate from a public health role, and then we'll continue to explore and probe and look for other things that maybe we should be doing as well.
So will the county provide specific guidance, though, on certain types of services, such as highlighting or perms or other things that use chemicals? And the governor made reference that there could be an environmental impact based on local ordinances.
Well, we can look into that. I think most of those are state-regulated entities, and so if the state gives them the ability to operate outdoors, we may have to engage to help facilitate that in the most appropriate way. But I think in general, the move to deliver services outdoors is something that we support and something we will be looking to make sure that we can put in place the proper structure to allow it to facilitate safely.
Okay, we'll go to the next question.
The next question will be from Vanessa Van Hefty with 10 News.
Hi, thank you. This question for Dr. Wooten, please. With the shortage that you have discussed with the testing and the results coming back a little longer, we're seeing a lot of these private companies. There's ads in the UT today, these private companies offering testing for $100 if you don't have insurance. Is there anything, Dr. Wooten, that you can tell the consumer about these places in terms of their legitimacy and kind of how they are carrying out business?
Okay, Dr. Wooten.
Thank you for that question about testing. Certainly, the county has numerous opportunities and testing sites that no one really should need to pay for a test. So we would encourage individuals to utilize the testing sites that are available through the county and the ones that are facilitated by the state on behalf of the county.
But there's been, just for my follow-up question, but you have stated, though, that there's been some delays, like some people are saying they've waited up to 10 days for the results. These companies are saying, we can get you results. Some of them are saying immediately, some are saying as soon as 2 to 3 days. And so I think that's the draw for a lot of people. So my question is, if people are in a hurry or they want those results faster and this is a way to do it, are these places, do you support them?
So while you hear about a long time, 7 and on occasion 10 days, that really is not the normal process. For the facilities that the county supports, which we are emphasizing to focus on individuals that are in the high priority groups, we now have a turnaround time of 2 to 3 days. The hospitals and clinics have a shorter turnaround time, as well as the turnaround time for commercial labs usually are the longest entities that have anywhere from a 5 to 7 day turnaround time. So do we support the facilities that are charging? The answer is we would determine if they can operate through the state. It is not up to the county to determine that, but we would work with the state. But in general, we feel no one has to pay for a test. So we have the opportunity for individuals that are prioritized to get their tests through the various settings that have already been identified. Does that answer your question?
Yeah, I think so. I think there was just, all this talk of, we have quite a few people saying they've waited over 10 days to get their results, and then people are saying, it's just to get an appointment sometimes takes 5 days. So when you can go to a clinic and get an appointment the same day and then get a result in 2 days, I think there's just that argument of that's faster. You're going to know a lot faster. So.
Well, I still
I don't
maintain
know
that that is not the routine process. I've heard just the opposite. Individuals that get an appointment on Monday and they have the result back on Wednesday. Again, you guys hear about, the media might hear about those extremes, but in the past several days, we've tested over 10,000 individuals, and that's just not the usual story, but that's the story that is shared with the media.
We have one final call-in question, and as always, it's Paul Sisson with the San Diego Union.
Oh, I'm so sorry. Go ahead, Paul.
Pulling up the rear again, I guess. Well, thank you for taking my call. What is the consequence of slower case investigation than was anticipated? What is the issue there with investigating these maybe a longer time frame than hoped?
Okay, Dr. McDonald's going to respond.
Thanks for that question, Paul. Again, having in an ideal world tests that are very rapidly performed with a turnaround time that gives a result quickly, that then allows us to be able to investigate quickly, to notify the individual about their results and responsibilities with their positive test, and identifying close contacts, and then in turn working with those close contacts to make sure that they know what they can do. Shortening those times gives us the best chance to get the outbreak under control. And as you've heard, there's a lengthening time frames for each one of those. There is a national issue with testing. Frankly, there is a national issue with case identification and investigation and contact tracing. And I'm grateful that we are getting more resources to be able to do that, and I think we will improve our ability to respond. But I think we are doing well compared to a lot of other jurisdictions. I just have to say that. But it gives me an opportunity to also say that we don't need to wait to be contacted. People don't need to wait for a test result to take appropriate action. If someone is sick and they're waiting for a test result, they need to stay home until they get that test result. And we'd like it to be faster, but they need to stay at home in the meantime. If you're a close contact and you got tested, you're still under quarantine, regardless of whether your test is positive or negative. And if you get a test result that's positive, the best contact tracer is you. That is turning to the people that you know and that you are in a household with and that you work with to let them know as quickly as possible. And what we find when we do get hold of our cases through investigation and contact investigation, many of them already know, because they've been told by the person who had the infection that in fact they were exposed and that they can take the precautions. And our follow-up with them is really sort of the extra information that they need to take action. So again, I think it's worth emphasizing that the process is slow because of the increased volume, and the county is addressing it. But in the meantime, each individual out there can address it by acting on their own results, if you're notified, going ahead and taking action on that. All the resources that we have that we go over with people in person are available online. So we really are relying on the community to do their part in this also. So I appreciate the question, because it takes emphasis on personal responsibility here to also take action when you know you're sick, when you know your test result, and you know who your contacts are.
I wonder, though, if the point of getting to these quickly within 24 hours is to, ask additional close contacts to self-quarantine. Do you feel like the slower pace has allowed the virus to transmit in the community more quickly than it otherwise might have?
I think, again, ideally, by shortening those times, we have the best chance of getting the virus under control. And so that's why we're working to do that. So we don't really know how much these specific circumstances are contributing to the outbreak, but I would say that the most important thing that's contributing to the outbreak are ongoing close interactions between people, in which social distancing is not occurring, with masks not being worn, and hands that are not being washed. I have to tell you, the loud and clear message we get when we do get hold of people is they say, I probably shouldn't have done X, Y, or Z, or I let my guard down, or I shouldn't have done this. And that's great in hindsight, but we have a chance, most of us haven't had this virus, and we can look in foresight and take those actions now and stick to them over the next number of weeks so that we can get this under control and we can start opening things back up.
Thank you.
Thank you. And just to add on to what Dr. McDonald said, it's there's a series of challenges that we confront as we tackle and navigate our way through COVID. It wasn't that long ago that we only had about 100 case investigators and contact tracers combined. Now we have more than 500. 500 is not enough with the increase in cases, and so we're adding hundreds of more, some very rapidly, a number of them this week. The same was true with testing. At the outset of this, we had very little testing. We surged our testing capacity. We ran into a challenge with the turnaround times. We found a new way to try to increase those. We're now averaging 3 days or less through our public health labs. The hospitals are much faster, and those are really the ones that are prioritized for the most important ones. But again, to reemphasize what Dr. McDonald said, as a case in point, I was notified that I had been in close contact with a positive by a contact tracer. Quarantine, I had a negative test, but even though I had that, I continued the quarantine all the way through. And so again, every individual out there, if we do all of the things we need to do around avoiding especially indoor settings with large gatherings, utilizing face coverings, hand washings, those really are the most important things, and we'll continue to do everything possible to increase testing, to increase the rapid return of results, to increase case investigators and contact tracers. And as a new challenge develops, then we will do everything we can to respond to it as quickly as possible.
Thank you.
Well, surprisingly, we have no texted question today, so that brings our media briefing to a close for today. Just a reminder that we do not have a scheduled media briefing tomorrow, but we will be back here on Wednesday at 2:30. If the media or others have a desire for information, they can always check our coronavirus website, which is coronavirus-sd.com. And again, we will return here on Wednesday at 2:30. In the meantime, please stay safe, San Diego. Thank you.